Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today I'm going to go over how we actually identify wound healing barriers. But first, if you could hit that subscribe button, it would be greatly appreciated as it truly does help my channel. So let's get started. So to identify wound healing barriers, we need to be doing a thorough and complete assessment of each wound, and it does need to be done on a weekly basis, okay? A poor assessment, if we're not completing a good assessment, it's going to have negative impact on the wound. It could cost us money that it doesn't need it, either the system or our patient's money, depending on the location, the treatment, the outcome of the wound. Like, this is the things that we have to be doing. We have to identify wound healing issues, okay? So when I talk about the wound bed preparation, I've been talking about this on my channel for a few months now, wound bed preparation and the mnemonic T.I.M.E.R.S. So we've been using this since 2003, and it has now just been updated to T.I.M.E.R.S to encourage a more patient-centered focus, okay? So the components of time. So before we have ever even looked at the time components, we need to be doing that full wound assessment, okay? So you get your wound assessment, and then we start bringing in, incorporating time, okay? So we're like tissue management, we're removing the non-viable tissue. Infection and inflammation, do we have it? Do we have bioburden? Do we have a biofilm? Do we need to reduce inflammation? What's going on, okay? Moisture balance, do we need, we want just an eyeball moist wound, okay? That's the moisture that we want. So do we need something that donates moisture, such as a hydrogel or petroleum? Do we need something that's going to wick away moisture? Okay, so more absorbent dressing, our alginates, our hydrofibers, our foams, our absorbent dressings. For what do we need to create that just moist wound? Okay. We need to look at the edges of the wound, okay? They need to be advancing, coming in, okay, and closing that way. That's how it needs to close. So we need to be looking at that also, but this is only after our full wound assessment. So along with time, okay, we want to incorporate the ABCDE approach, okay? So the first, the A is assess. So we want to implement an effective wound management strategy, okay? So using our assessment, okay, towards a successful wound healing outcome. Because if we're attempting to try to heal a wound without properly assessing comorbidities, underlying risk factors, what process, like where are they in the wound healing process, everything that we need to manage, that we just discussed in time. If we're not assessing all of this and putting it all together and just throwing a product at a wound, I mean, it's not going to heal properly, okay? We also need a multidisciplinary team, okay? For example, a nutritionist, they may be able to see where they're lacking, okay? Maybe they need more protein to allow healing, the healing process. Or maybe they need a pain management team. Somebody, if they're in pain, it puts off these like little like if I don't I don't know what I'm trying to say here. If you are trying to heal, okay, there's like a whole system that goes on in your body if you're in pain, okay? And it will not allow your body to heal if you're in pain. Okay, that's what I'm trying to say here. These things need to be controlled. So you need to bring in a team of people to care for this person, to optimize wound healing altogether. okay? We need to control, so identify and treat underlying causes and barriers. Okay, so what's the cause of the wound? What's any barriers? We need to recognize them, communicate with our team, and find ways to control the situation to get the outcome that we want. We need to decide the appropriate treatment. Okay, now this is based on tissue type, wound edges, infection, inflammation, bioburden, moisture level. Okay, we need to bring that all into factor, and then evaluate. So once a week you're looking at this wound, seeing and evaluating the treatment method that we're using. Is it working? Okay, so these are all things that we need to use to identify healing barriers and how to overcome them. So these are the tools that we are using. So as clinicians, we need to remember that even the smallest break in the skin, they all heal the same way. Okay, they all go through the same healing process. So wounds need to be assessed. Each and every single wound needs to be assessed. There's no one treatment plan for all wounds. Okay, yes, we may have a venous leg ulcer, but just because Jim has a venous leg ulcer and Mary has a venous leg ulcer, it doesn't mean that we can treat them the same way. Okay, we have to assess this as a whole, use our time, our timers, along with our ABCDE approach, because that encourages a more holistic wound assessment, determining any underlying etiologies. It also assesses patients' psychological needs. We need to look at this as a whole person, okay? So we need to be looking at their comorbidities. What are things, anything that could be a barrier to that patient's healing process? We need to be looking at that. And once we have a whole picture, then we can treat the hole in the patient, okay? That is my favorite saying. Look at the patient as a whole, not just the hole in the patient, okay? That is how we get proper wound healing, okay? Especially with our chronic wounds. These are hard to heal wounds, but if we're doing proper assessment, using our tools, we will get them closed. Okay, guys, that is all I have for this video. I hope to catch you in my next one. Bye for now.